Firstly, can you take us through how exactly did Singapore manage to get on top of it?
Singapore's quite unique in that there are really two outbreaks happening concurrently. There's the community at large, the outbreak, and that really peaked at about 70 cases a day. That's never been a huge problem. Currently, that's running at single figures. The last couple of days have been 3 and 1. So that's what I'd call living with the virus. Altogether, there's been just over 2,000 cases in Singapore's broader community. Now, a separate situation arose in the dormitories, which is everyone's familiar with, and this actually continues on. This is a very difficult and unique situation where a very large number of men in a large number of high-density dorms, it's been very difficult controlling spread through there. And that outbreak is still going on, to be honest.
What do you think that Australia can learn from this, learn from other nations like Singapore who have managed to live with the virus, as you said?
Well, I think every country is trying to figure out how to live with the virus. Actually, that's not true. Not every country. I know New Zealand have effectively eradicated, and some states of Australia seem to have eradicated it. That's not a policy that I would particularly support, because I don't think it's sustainable in the long term. But everyone else is trying to learn to live with the virus, and this really means that you can identify cases early, you can do the contact tracing, you can shut down chains of transmission, and this is a sustainable effort. But it takes tremendous community buy-in to modify behaviours as everyone's really learning. You can't get back to business as usual fully.
Singapore used, I guess, a Melbourne-style lockdown, but why do you think that Victoria has now failed?
Well, everyone's done a lockdown at some stage in various different forms, whether you're in Europe or any state of America, the whole of the Middle East, South America, have all done lockdowns. And lockdowns, no one believes that that's a good long-term strategy, just as I think border closures are not a good long-term strategy. But these are times to get your systems in place. And getting down to low numbers because of a lockdown does not mean you've done well. That means you've bought some time. And as you come out of the lockdown, can you manage the disease? Can you, as I say, live with the virus? And what you just described is happening in Germany and France. These are countries that are now being challenged. You look at like South Korea, for months it's had sort of 20 to 40 cases a day, and I would call that living with the virus. They're identifying cases, they're shutting down transmission chains, and life does have a degree of normality to it.
How does a country measure its success in tackling it?
Well, it's whether you can shut down those transmission chains and identify cases. And what we found was that Victoria clearly didn't have the preparedness in place, particularly for those vulnerable sites. And they unfortunately lost control and had to re-invoke lockdowns to various degrees. Of course, we all hope they can regain control. I look at New South Wales and I think there is a state that's really trying to live with the virus. They accept it's there. They're not going to shut down everything, at least hopefully never. But if they can bring it under control and live with cases and clusters, protect the elderly, things like this, then that would be a success story. Not having 0 cases with shutdown. That's not a success. A success is when you can manage it and live with it.
What do you make of mask wearing? Do you believe that places like Sydney should perhaps start introducing mandatory mask use, as Melbourne has done?
Well, many of us were slow to masks, but when data started coming out in February and March of pre-symptomatic transmission, then masks really became somewhat of a no-brainer. If the alternative is losing control locking down, the economic hardship, then you'd have to argue that wearing a mask when you're not home is a small price to pay for the period of time that we're battling the virus.
And just finally, putting aside the situation in Victoria now, overall, how do you think that Australia has fared, but particularly how has our response been compared to other places around the world?
Well, I think the response, I would have to say, you'd have to look at New South Wales and say that looks like it's doing well, but I don't really give any kudos to states that have shut their borders and that's their way of dealing with this, because there may never be a vaccine. It may come in years. It may not be fully effective. It probably won't be fully effective. And there's going to be there is a lot of vaccine hesitancy. So a lot of people are going to refuse to take it. So every state or country that's bunkering down and waiting for the magic bullet of the vaccine, I doubt that fairy tale is going to happen. I doubt one day we're going to wake up and the tests all show that everything works, it's distributed, we all get vaccinated and get back to normal. That's the fairy tale I think everyone is looking forward to. But there's a lot of twists and turns in this, and having early releases with a lot of skepticism, the US quite likely to shortcut some of these measures through their emergency legal frameworks. This worries me a lot. So I think if your only strategy is to bunker down and wait for a vaccine, then I think you're going to be looking at yourself in months and a year or more to come and say, what do we do now?